a woman who died of sepsis after a botched breast augmentation surgery in Kenya, right here in the country, not elsewhere. At what point or when can such a procedure, fail and lead to such fatal circumstances?
So I think the most important thing, again, and I will reiterate this so many times, is to choose a qualified professional surgeon. Do your homework, please. We really do appreciate clients or patients who know about the procedure so that we can have an engaging conversation. Because if you choose someone who is well qualified, the chances of complications are reduced. Having said that, remember, cosmetic surgery is a surgery like any other. So during the consultation, after having discussed what is expected, we do discuss complications. And complications, we classify them, one, regarding to anesthesia, because sometimes you will be given general anesthesia where you are completely down. So we have to also work with a qualified professional who know what they're doing. Number two, there are also complications regarding the procedure, so the specific procedure. So there is something like, probably like bleeding. We anticipate that. How do we counter that? We will use something we call electrocautery, that is electricity, to make sure you don't bleed. If it's an infection, we will give you antibiotics during the surgery. We will use sterilized equipment to make sure that you don't get an infection or reduce the chances of an infection. Then post surgery, being that it's a surgery like any other, and especially in patients who have a high BMI, they are prone to getting clots. And so we may have to put them on blood thinners. So these are patients we also maybe have to monitor post-operatively. We have to have a very close relationship with them. So I do agree. Cosmetic surgery is a surgery like any other. There are chances of complications, and we do discuss this openly with our clients. We do not hide or pretend that it cannot happen.
Right.
But there are measures that we have put in place to try and reduce these complications as much as possible. And that is why you will also sign a consent. Having said that, we have discussed, you are aware, and if this happens, the doctor will intervene and give their all to make sure that we treat you well and counter these complications. Yes.
And in my research, I discovered that there are people who have had, what would call failed procedures. Say, like for instance, in the butt enlargement, and then one is bigger than the other.
Yes.
And they now want to go back to normal.
Yes.
Is that possible?
Yes, it is.
What does it take?
For example, now we have people in the Western America. You've seen a lot of people are now reversing their BBLs. Now it's a trend. Kim Kardashian has reversed, Black China has reversed. So even here, we feel like it will catch up with us. So the fat that was injected, now you can go and liposuck that fat. Yes, so you can reverse some of these procedures. It is possible.
But why? I mean, okay, fine, that's a failed one, which you're reversing.
Yes.
But this other one, which went okay and you want to reverse, why would one want to do that?
Some people do have cosmetic surgery because it's a trend. They want to look a certain way, probably because of their industry. So when we are looking at people who are in the limelight, they feel like, or they are supposed to look a certain way so that they're able to sell their product or who they are as a person. So when this certain figure or who they are is out of season, and maybe now they have to go to how they were looking before, then they will ask for a reversal of the procedure. And it is possible for us to reverse, so why not?
Why not?
Why not?
Yeah.
Plus also, I just think maybe some are age-bound, like let's say breast enlargement. Now think about yourself, you had breast enlargement as you're growing up, and now you're in your 60s with a 16-year-old,
Double Ds.
Double Ds. So you're wrinkled everywhere, except your double Ds are really D, you know?
That's true.
I mean, so some of those things are not, like, it's hard to have them forever. And also, I think some can just be because of health factors. You start having a complication here, a complication there. I mean, and complications can be maybe you are not financially stable anymore to sustain this cycle.
Sure.
So which means probably there's something leaking, there's something, you know, whatever, if I may think, you know. Yeah, so you just like, okay, let me just do away with this thing since I can't afford it anymore. The financial source, whatever was supporting you to be able to support this lifestyle is not happening as it was.
Yeah, and let me ask, have you had instances where, let me just put it like, exercise fails, or the kind of training you're giving to your clients fails, maybe because one is indisciplined, or just because their